Hey everybody, so I am Dr. Tanya Goodrich. I am a pelvic physical therapist and I've been one for the last 15 years. My number one tip for your bladder during perimenopause and menopause is learning how long you should be going to the bathroom or how often you should be going to the bathroom a day because we're not taught that. And I have a really easy way. So essentially, normal peeing is every 2 to 4 hours. And I know for a lot of people out there, that's shocking because you're going every 45 minutes, every 30 minutes, thinking that you just have a small bladder. We treat small bladders all the time. And the first rule about understanding bladders is knowing what correct is, because then you have somewhere to go. But guess what? You should not be peeing every 30 minutes. That's terrible because then your bladder is ruling you and not you are not ruling your bladder. And so this is what you want to do. The first thing is just jotting like the time that you went pee, right? Like, oh, I woke up at 7 and that's the first thing is when am I going? And then the next thing is counting the length of your pee. And I'm talking like 1 Mississippi, 2 Mississippi, and your pee length needs to be at least 12 seconds long, at least. And like, not to brag, but I can pee for like 29 seconds. Again, not to brag, it's just to show you like how long a normal pee stream can really be. And honestly, that is shocking for so many people listening right now because they're like, no, that's impossible. I definitely pee more like 6 seconds. But now the whole point is that if you're peeing for 6 seconds, that just means that it's like it got into a vicious cycle where you're like, oh, I go every 30 minutes, and then it tells you it's time to go, and then you go again, and then all of a sudden you have this like train that's just going all the time. So the first thing is just like, hey, we're gonna stop this and start to pay attention. And let me tell you, the changes can really be soon and they can really be dramatic once you know what normal is. And in our profession, we call it jicking, and we do it just in case peeing. And we do not want to be jicking, right? Because it really gets into bad habits. Every once in a while, if you need to jick, no problem, right? If you're going to go on a road trip, I get it, go pee. But if that becomes your normal, we have a problem. So this is the easiest way to kind of get a grip on your bladder and start to teach it what correct is. So that's my top tip.